Dismetabol 3xBiotics. In a world where sedentary lifestyles and unhealthy diets are becoming increasingly common, metabolic syndrome is emerging as a silent epidemic of the 21st century. This complex condition is characterized by abdominal obesity, hypertension, hyperglycemia, dislipidemia, and insulin resistance, with each component amplifying the impact of the others, creating a vicious cycle. Insulin resistance plays a central role in the development of metabolic syndrome and its associated conditions. When the body's cells do not respond effectively to insulin, blood glucose levels remain elevated, forcing the pancreas to produce even more insulin. This chronic hyperinsulinemia creates a state of systemic inflammation that contributes to tissue damage, often described as a precursor to many conditions, serving as a starting point for a series of serious complications. People diagnosed with this syndrome face a significantly higher risk of developing chronic diseases such as diabetes, cardiovascular conditions, atherosclerosis, hypertension, heart failure, cardiomyopathy, sleep apnea, liver diseases, non-alcoholic fatty liver disease, liver fibrosis, cirrhosis, etc., kidney diseases, chronic kidney failure, microalbuminuria, diabetic nephropathy, glomerulosclerosis, neurological conditions, stroke, diabetic neuropathy, cerebrovascular disease, cognitive decline and dementia, depression and anxiety disorders, epilepsy. Additionally, there is an association between metabolic syndrome and certain types of cancer: liver, pancreatic, colorectal, gallbladder, postmenopausal breast cancer, etc. Amrita polyfloral pollen fermented in SCOBY cultures through its rich content of short-chain fatty acids acetate, butyrate, propionate, pentadecanoic acid C15, etc. contributes to the reduction of systemic inflammation. In recent years, the presence of C15 has attracted attention due to its beneficial effects on cell membrane fragility. It moderates oxidative stress and has an anti-inflammatory effect. Imbalances in the profile of membrane fatty acids can compromise membrane stability, leading to cell membrane fragility, triggering ferroptosis, a new type of cell death at the erythrocyte level. It causes their destruction with the release of iron, which enters hepatocytes and, together with ROS, leads to their death and replacement with fat cells. Combating cellular membrane fragility is also enhanced by the action of polyphenols from the green tea used in SCOBY cultures. The consequence of this phenomenon at the hepatic level is non-alcoholic fatty liver disease, fatty liver, and at the pancreatic level, it blocks the insulin secretion of beta cell. Cellular membrane fragility also increases insulin resistance. Through its rich C15 content, Amrita decreases insulin resistance, reduces fatty liver, moderates oxidative stress, has an anti-inflammatory effect, maintains blood pressure within normal limits, and protects the cardiovascular system. Numerous studies demonstrate the beneficial effects of organic acids, especially acetic acid, on metabolic syndrome. They stimulate the activity of enzymes involved in fatty acid oxidation and inhibit those involved in lipogenesis, thereby reducing fat accumulation. Increase the expression of insulin receptors, and the activity of AMP-activated protein kinase A (MPK) can influence the levels of satiety hormones, such as leptin and gut peptides, leading to a reduction in caloric intake. Can stimulate nitric oxide production, contributing to lower blood pressure. Polyphenols and flavonoids have strong antioxidant properties, prevent the formation of atherosclerotic plaques, and promote cardiovascular health. Ergothioneine, known as the longevity vitamin, helps reduce LDL cholesterol levels and thereby improve dyslipidemia. Spermidine stimulates autophagy and protects beta pancreatic cells, contributing to improved insulin secretion and reducing the risk of hyperglycemia. Prebiotics, probiotics, paraprobiotics, and postbiotics balance the gut flora, improving the digestion and metabolism of carbohydrates, which helps maintain normal blood glucose levels. Rare sugars, such as ribose, mannose, arabinose, and galactose, are fermented by beneficial bacteria in the colon, improving metabolism and reducing fat accumulation, thus combating abdominal obesity. Astragalus membranaceus improves insulin sensitivity. Its main active component, astragaloside IV, has antioxidant and anti-inflammatory properties, which help protect against atherosclerosis and other lipid metabolism-related conditions. Research has shown that Gymnema sylvestre can inhibit the intestinal absorption of glucose and increase the activity of glucose-metabolizing enzymes, thereby lowering blood glucose levels, a major risk factor for hypertension. It alters lipid metabolism by inhibiting enzymes responsible for cholesterol synthesis and fatty acids, and by stimulating cholesterol excretion it reduces body fat accumulation by regulating the expression of genes involved in lipogenesis and lipolysis. Cinara cardunculus var. Scalamus, also known as artichoke, is widely used in traditional medicine due to its potential benefits on metabolic health. It inhibits hepatic cholesterol synthesis and stimulates its biliary excretion, reducing the risk of ischemic stroke. Research has shown that artichoke extract inhibits digestive enzymes that break down carbohydrates, thus reducing glucose absorption and improving insulin sensitivity. The antioxidant properties of artichoke contribute to protection against oxidative stress induced by hyperglycemia, thereby maintaining vascular and metabolic health.